between rival generals is feeding one of the world's worst humanitarian disasters. Over 8 million people have been displaced since the army and the RSF paramilitary forces began their power struggle. Tens of thousands of people have been killed. Millions are on the brink of famine. Now, just last month, France hosted a conference to boost international aid donations. It's only 5%, a fraction of the UN's 3.8 billion euro target had at that point been delivered. But some local aid groups operating on the ground in Sudan struggle to access even the little such funding available. And they're saying that there is an urgent need for change in the mindset behind the global humanitarian system. So for more on this, I'm now joined by Dr. Maha Suleiman from the Sudanese American Physicians Association. Maha, thanks so much for making the time to speak to me. Now, first of all, what are some of these limitations of this global top-down approach to humanitarian support that you think is particularly problematic, and what do you want to see change with regards to that?
Thank you so much for having me. I mean, obviously, we want to see all these millions promised be carried through and the actual funding is delivered. But I also feel like, I think recognizing Sudanese and local organizations as partners for effective aid delivery is critical at this time. I know this has been talked about by the international organizations for a long time now. However, in reality, we as Sudanese grassroots organization, we have not seen it. We are the ones who are deeply interrelated with the communities affected by the war. I'm talking about neighborhoods we lived in and friends we grew up with and our own families left behind. We have a deep understanding of the social and the cultural aspects of these communities, but we have not seen a real commitment for partnership, unfortunately. So I feel like if we want to talk about effective aid delivery, not only in the immediate relief efforts, but more sustainable interventions like empowering local leaders and building those community resiliences, I feel like entrusting local organizations like SAPA and Hadreen and others with direct funding is a must.
So just break it down for us. Why are organizations like the Sudanese American Physician Association not getting the kind of money that we see talked about at these kind of big international donation drives as we saw here in France?
There is partnership with the UN organizations in some projects, but there is no direct funding. I think historically the argument was that local partners, there's concerns about impartiality and accountability of the local partners, which I believe does not stand as a strong argument because, for instance, the Sudanese American Physician Association, SAPA, just got the Candid Platinum Transparency Award, which automatically ranked this organization in the top 0.1% for, in terms of transparency and accountability. And we have bridging huge gaps, especially in the healthcare sector, since the war has started, and we're still present in Sudan on the ground and working. Hadreen, for example, is an organization that provides food assistance to a lot of the displaced populations, and they have consistently showed their value and that they can do this. However, the trust is not there for us to provide, to receive direct funding, unfortunately.
And do you think that you have actually made enough of an impact that makes you feel happy with the role that you're doing within the strictures of the current setup?
Absolutely. I feel like I can speak for SAPA. SAPA has naturally worked in the healthcare field where 80% of the healthcare facilities were out of service since the start of the war in in April 2023. There's a tremendous work through extensive network and personnel on the ground to bridge the gap and continue healthcare services, especially to women and children. I mean, the gap is unfortunately still huge, but we are the main healthcare providers in 4 large states at this time. And our priority is to expand to other states and maybe, kind of restore more of the specialized services. We managed to do that through the challenges and the very fluid, dangerous situation through direct funding of healthcare facilities and healthcare workers. So SAPA has supported like 25 healthcare facilities since the beginning of the war. And in addition to other things like mobile clinics in the IDP camps and supplies and food and nutrition service. Actually, in Eastern Chad, SAPA is the only Sudanese organization that is providing food assistance at this time. So I think we proven our value through all the interventions that we have been doing, and we partnered with the UNICEF and other UN organizations, because we gained some of that trust by the work and the accountability we have shown so far.
Thank you so much, Maha Suleiman there from the Sudanese American Physician Association, working with grassroots organizations in Sudan to try and get help and medical care to those caught up with the fallout from the year-long war.